Friends, good morning to all of you. I was trying to get some feedback about what happened yesterday, because I did miss the spirometry. I am here to share with you my experiences about the management of respiratory diseases today. Now, we come across many challenges in the day-to-day practice, especially in conditions of respiratory disorder, because there is a extensive difficulty in getting a clear picture. To obtain an unmodified clear picture is difficult because of the interference that happens. Secondly, the remedies, though indicated, do not show a positive response or show a partial response. And the third challenge that we encounter is to understand respiratory problems in children cases. How to identify the characteristics and how to assess, analyze and come to a conclusion of the remedy, the potency and so on. Next challenge is patients who are dependent on other mode of therapy. More often, chronic cases when we come across are dependent either on some inhalers, which is very common. That is the first line of therapy which is usually administered. Patients who are using up to corticosteroids and repeated use of antibiotics. This is and how to manage in homeopathic perspective. We look into all these things, and of course where there is a consistent environmental maintenance cost. Like this. The role of miasm. Now, this is one thing, I am not elaborating anything, but what we encounter is an episodic attack of a single miasm that is presenting different picture. Secondly, where there is a mixture of miasm. And thirdly, what has been recently seen is the complexity that arises because of the drugs, which doesn't give a very clear picture of one miasm. Then the following would be, which modifies the picture. It doesn't allow the picture to evolve clearly, confusing the totality. Then we have miasm also plays a role in obstructing the action of the indicated remedy, and how to identify and how to remove them so that the action of the indicated remedy flows freely and brings about a resolution. And we are pretty well aware miasm is the main factor that makes diseases chronic. So hence the importance and the emphasis of understanding miasm becomes mandatory. Now this I am not going to elaborate. Now, as we know, respiration is a process of breathing in and breathing out, which oxygen symbolizes the mainstay of life. Similarly, emotionally, the love becomes the main source of emotional state and mental development. So, there are various emotions that play a role in the evolution of disease. How that, for instance, in children it is very common. More often in your practice you must be encountering the child when it is sent to the school on the first day. The child falls sick, which is not common. On a Monday, many parents come on Monday and they say that the child is falling sick. So there is a separation anxiety, or in the present day, we know that both the parents who are working, they have no option but to leave the child in a creche. Unlike the older days where there was a bigger family, the nuclear families are encountering these problems. So there is a main connection between the emotions and the development of diseases, more so the respiratory. So also the arrival of a new sibling, there is a subjective feeling of a competition. So there is certain amount of insecurity of love. There is a threatened feeling that the love is being taken away by the next child. So it may lead to some amount of sibling jealousy, so which can also precipitate in repeated respiratory attacks. So also we know that whenever there is a suppression of any emotion, especially anger, which can also result in respiratory disorders. Right? So what is the best way to go ahead? There are many approaches that have been practiced, but what has stood the time is the classical homeopathic approach. That is the constitutional approach, taking down the chronic totality and identifying the acute phases of a chronic disease and the acute disease. If we are able to clearly define and if we are able to understand these time-tested principles, we cannot falter in our resolution. One more step. And there is one more, understanding what we normally use the word as an intercurrent phase. When there is an obstacle to recovery, as I said earlier, whenever the indicated remedy is not responding, that indicates an activity of a hidden miasm. A hidden miasm which has become dominant at that phase. If we are able to identify, using a suitable remedy will help us open up the case, allow the indicated remedy to work. So with this background, we'll flow to the next. So this is one case. Yeah. This is the preliminary background. Next. Now, this lady complained of obstruction, nasal obstruction, going for wheezing, and cough with thick sputum, and there is an affection of the location of chest, trachea and bronchi with a substernal oppression, dry cough, gagging, breathless, occasionally yellowish sputum, once a month for almost 7 years. Worse by change of weather, more so the dry cold weather, worse cold places, worse rich food, worse damp, worse after delivery, and he was on a dependent dose of serotype and frequent use of antibiotics. Next, during an acute phase, wait, don't rest so fast. He would become very emotional. Her emotional expression behavior was weepy. The third place, swaying around. She would feel that swaying sensation, and she was diagnosed earlier as an obstructive airway disease, and the presenting symptoms were of more of tracheobronchitis. Next. Her associated complaint, she was a known case of hypothyroid on L-proxin since after delivery. She was a case of seizure also, since Spiritorium now on inquiry. And her personal history revealed. These are the essence which I am projecting to you. Can't control hunger, third place, reduced taste, better by eating, tendency for constipation, has to strain a lot to evacuate the stools, and her thermal response is chilly. She is a chilly patient. para 2, para 1 and living 1 and 1 abortion that was induced due to increase in seizure tendency. So there was a delayed breastfeeding. Right? So this is one of the observations, gets leukorrhea before menses. Jaundice as a child, appendicitis at 14 years. She had to undergo an arthroscopy due to slip patella. Father a case of bipolar disease since 20 years. So we'll just take out some essences from her life space. Father was a bipolar with parental negligence and couldn't run the family. Mother took over the role of and took care of the family. Patient was very much moved by father's emotional suffering. He also developed the steel of mother. So that you see how the child gets tries to balance between on one side she's responding to father's suffering and at the same time she is getting the strength of mother. Go further. They stayed in a joint family and patient loved being a lot of cousins and uncles with a lot of cousins. When patient was 10 years, family differences and family got separated, which patient felt deeply. So that emotional separation also affected the child. This is when her health started getting affected. Next, patient always helped whenever someone in the house was sick, was more sympathetic. He cared a lot about the father and other people at home. And she had a special refined sensitivity towards animal and not just sympathizing with the animal, go to the extent of helping them. Next. Now, if you understand this mind from the essence that has been given, we get the following qualities of being sympathetic, caring, attachment, affectionate, compassionate, lovable, compassionate, lovable. Hello. Hello. Is a lovable person. Next. The miasmatic analysis, it says slow, gradual progression, and this is the oppression and spasmodic effects, obese build, hypothyroid state, so psychotic miasm is clearly evident. Next. Acute totality reflected rich food which aggravates, closed place aggravates, emotional during an attack, thirstless, thick yellowish sputum, then substernal oppression. And remedy was clear as far as the acute totality was concerned. Right? Now go to the next one. Constitutional totality. We have run through this. Anyway, for the prescribing totality, sympathetic, affectionate, compassionate, thirstless, hunger, obese, constipation tendency, chilly, emotion, endocrine, respirator and CNS. Wait. Okay, run through. Remedy was causticum. Just wanted to group 2. Okay, anyway. So causticum was selected as the constitutional remedy and differential remedy came close to pulsatilla, but causticum is much more compassionate compared to pulsatilla, who is more sympathetic and bit more self-centered. Mental characteristics, the pathology and the psychotic miasmatic dominance, 200 potency was selected and chronic disease needs repetition. For the acute, pulsatilla was used depending on the acuity every 2 to 4 hours to avoid the attacks. Intercurrent, this is the planning Intercurrent psychotic obeys chili and spasmodic pathology. Tuja was selected as an intercurrent in the event if the indicated remedy fails to respond. So that was the planning. Next, started on weekly doses of causticum. There is a more deep acting remedy, and being psychotic the response we have to wait. Pulsatilla 200 had to be used during an acute attack, and after about a week we had to reduce the serotype, and she was able to manage without the help of serotype, and the frequency and the intensity came down. Yes. Progressive reduction in respiratory troubles. No attacks of seizure or aura felt during the last 2 years. Of course, she was all incorrect that we had left the neurologist to reduce the dosage. Etroxin dosage was reduced in about a year. So we had to use only 1 dose of Tuja as an intercurrent during the last 2 years. The conclusion in this case is it's a more a classical approach with a constitutional and acute as and when necessary, and the use of intercurrent remedy. So we'll go to case number 2 after this. This is a small child's case, and complaint was begins as a cold with least exposure and rapidly develops to cough incessant, spasmodic initially with scanty expectoration and turns viscid purulent with erratic fever. Gas for breath, complaints of chest oppression during cough. Present since the age of 1 year, lasts for 15 days, worse winter, worse monsoon, worse cold food, worse lying down, worse exposure to draft of cold air, and 6 p.m. to 1 a.m. aggravation. And during an attack, the child would become violent, and the mother would say it becomes very cranky, and he would go into the extent of destroying. And physically, he was very, very weak and listless. And on the personal history, the irregular appetite, craves curds, aversion milk, perspiration on the scalp, offensive, sleep during, lean build, thin silky hair, glossy nails, appetite irregular, mother, a case of hypercholesteremia. Maternal grandfather had bronchial maternal grandmother hypertension, and psychiatric case quite vague. The details were not available. Mother was keen on a job, didn't want to continue the pregnancy, but the termination vetoed by the family, agitated and angered but suppressed. That is a mother's mental state during pregnancy. Developed hypertension at 6th month. The child was a preterm baby. Now the child's mental state, the child is very aggressive, beats and bites when angry, scratches mother's face. These are all the behavioral qualities. Throws things when contradicted, can be stubborn and headstrong, will not yield to reasoning, plucks hair during sleep, poor concentration, loves when taken out. Now the prescribing totality, aggressive, violent, poor concentration, stubborn, loves traveling, lean build, thin hair, sweating and scalp offensive, aversion milk, craves yogurt, descending cold, evening and night aggravation, winter and monsoon aggravation with purulent expectoration, acute totality, rapid descending cold, erratic fevers, characteristic concomitants of violency, crankiness and weak and listless, exhibiting tubercular miasmatic phase. I think the remedy somebody suggested already. When you have a totality, it is easier to prescribe. To derive the totality is a challenge. In children, I think observation about the behavior, how they, I had one interesting case, maybe I'll share later. You can go into that. This tuberculinum was the remedy. But the beauty of tuberculinum in this case, you should see, the potency obviously was 200 because it balanced both between the active miasmatic phase, the mental picture that it controlled, and the physical build. The child was started on 200 tuberculinum, and during an acute phase, because the acute totality also was covered by tuberculinum. Because tuberculinum, out of anxiety, many times we restrict ourselves to only as an intercurrent remedy. But it can become an acute remedy unless, but you should be very thorough, very sure that it is an acute remedy. So it has phases. Next. The follow-up, attack frequency reduced, need to repeat came down in about 3 months. Child's behavioral pattern improved, mild attack but resolves with occasional doses of tuberculinum. Now we'll go into some acute cases. These two cases, what I reflected were more on a constitutional basis. What I am reflecting now is some acute cases which happen during day to day. How much time I have? Not sure. 9:45 I started. Oh, we have 20 minutes. That's good time. Yeah. Baby JK, 8 months, started at 6 months with sudden respiratory distress, severe wheezing and cough, started after a short bout of fever, better by nebulizing, recurrence frequent since then. Yes, presenting complaints, sudden choking type of cough, expectoration profuse and sticky and ropey, associated with fever, worse when the child falls asleep. What is the probable diagnosis? Concomitancy can show. Yeah? Go ahead. Cranky, irritable, flushed face. What is the diagnosis? It's an 8-month baby with sudden choking, respiration with cough, visits sputum. What do you think of? Okay. Sorry? Bronchiolitis, very good. Yeah. Acute bronchiolitis, this is common before the age of 9 months, right? Right? So the prescribing totality, sudden choking respiration, worse falling asleep, sticky ropey expectoration, cranky, irritable, flushed face, that is the concomitant. What is the remedy? Sorry? Kali micro, yes. Anything else? That's how do we appreciate the characteristic in children's case is a major thing. That is the turning point. Because colibacromicum, we normally, it depends on if you have taken sticky respiration, this one expectoration as a characteristic. Colibacromicum is the first remedy that comes into our mind. But we'll look into that. Because if you look into sticky expectoration, you will find not less than 25 remedies in repertory. Grindelia was the remedy because falling asleep aggravation, right? Sudden choking, no? And the spasm that Grindelia can produce is nowhere comparable to Calibac. It's something like a cupra. So this had to be given every 15 minutes and the accused promptly controlled and cleared the attacks. Of course, this was followed later by constitution. I am not giving the constitutional totality here because this was already defined and we had to restore the susceptibility by giving Lyco in this case. Yeah. This is a case of croup. 7 years. This is going on since about a week. Persisting barking, gagging cough. Throws of stringy, thick mucus at the end of the cough. Pressing pain in the chest. Was midnight after this started after an attack of measles. Was laughing and talking. Now this was an observation. Mother would say the amount of talk that the child does after the cough, after an attack of cough. It's a peculiar symptom. Desires hot water to drink. On examination, the lymph glands were like a bead around the neck. Cold sweat, loss of weight since measles. Prescribing totality, ailment from measles, barking, gagging, cough, worse talking and laughing, midnight aggravation, loquacious after an attack, neck gland like a bead, and a tubercular presentation. What is the remedy? So you are entering the case through location, right? That's what happens. Now, do we prescribe for the totality or do we prescribe only for the locality? Or one may start only with marbillion because this ailment from measles, possible, no? Or pulsatilla. It depends where we locate ourselves in prescribing, right? But put this entire thing. Okay, we'll go to the next step. Remedy is nothing but Drosera. And it is one of the topmost remedy for ailment from measles. And it has that beautiful concomitant of loquacity after a bout of cough. I didn't know. I referred that and I was able to, because that symptom I have never used in my practice. In this case, I learned that. And it was prescribed every 4th hourly and tapered to 3 doses a day. Needed a week to recover. A tuberculum was given as because this is an expression of tubercular miasm, an intercurrent remedy, dose of tuberculum was given as a conclusion to help the child. Yeah, next. And calcarea fast was followed later to stabilize the susceptibility. Now the child is restored to normalcy. Go to the next case. Now, yeah, I think I have concluded the cases, but some observations, some general tips which I can share with you. Yeah. Drosera has a barking cough. Can run through them. Ailment from measles, worse talking and laughing. Palpable lymph node, lymph gland like a bead. Just think of Drosera as the first remedy. Yes, Margaret Taylor strongly recommends Drosera as a strong tubercular remedy. Coccus cacti, which is common in practice, violent paroxysmal cough, vomiting of ropey, thick mucus, more intense than colibic, flushed face, better by cold wash, corallium, you have that gasping followed by spasmodic cough, reverberating cough, hot when covered and still uncovered. Next, sticta, dry hacking cough, worse inspiration, worse tired, ailment from measles. 1 minute. Cocalucin or pertussis. In sticta, you can also add up this root of the nose. It acts on the roots basically, but chronic obstruction, especially at this area. Sticta you can add up. All types of whooping cough, pertussinum, sobbing or sighing at the end, strangling sensation, worse waking, associated with coryza. Grandilia, choking, gagging cough, worse falling asleep, say a very characteristic concomitant, profuse secretion, tenacious expectoration. I think the time is up. No? Yeah. Thank you.